Staphylococcus aureus. Key feature: Staphylococcus aureus gram-positive bacteria, cytoplasmic liquid membrane, thick biological layer, theotic acid and lipids are present. Staphylococcus aureus is coccus shape and appears in pairs, clustered and short chains.
Staphylococcus aureus is a gram-positive spherical bacterium which on microscopic examination appears in pairs, short chains, or as bunched grape-like clusters. Some strains are capable of producing a highly heat-stable protein toxin that causes illness in humans. Staphylococcal food poisoning is the name of the condition caused by the enterotoxins which some strains of the bacteria can produce. The onset of symptoms from food poisoning from this type of bacteria is usually rapid and in many cases acute, depending on the individual's susceptibility to the toxin, the amount of contaminated food eaten, the amount of toxin in the food ingested, and the general health of the victim. The most common symptoms are nausea, vomiting, retching, abdominal cramping, and prostration. In some severe cases, headache, muscle cramping, and transient changes in blood pressure and pulse rate may occur. Recovery generally takes 2 days, but can take longer. Foods that are frequently incriminated in staphylococcal food poisoning include meat and meat products, poultry and egg products, salads such as egg, tuna, chicken, potato, and macaroni, bakery products such as cream-filled pastries, cream pies, and chocolate eclairs, sandwich fillings, and milk and dairy products. Foods that require considerable handling during preparation and that are kept at slightly elevated temperatures after preparation are frequently involved in staphylococcal food poisoning. Staphylococci exist in air, dust, sewage, water, milk, and food, or on food equipment, environmental surfaces, humans, and animals. Humans and animals are the primary reservoirs. It is present in the nasal passages and throats and on the hair and skin of 50% or more of healthy individuals. This incidence is even higher for those who associate with or who come in contact with sick individuals and hospital environments. Although food handlers are usually the main source of food contamination in food poisoning outbreaks, equipment and environmental surfaces can also be sources of contamination from the bacteria. To learn more about foodborne pathogens, toxins, and food testing services, please visit the website shown on the screen.
Where can you find Staphylococcus aureus? Found in humans and animals, and particular Staphylococcus aureus strain may be associated with particular type of the animal of human. For example, castle strain now as CC425. Skin and mucous membrane, where do 80 million Americans carry Staphylococcus aureus in respiratory tract. Symptoms: small red bumps on skin, pus filled and voice, and invades the respiratory tract.
Staphylococcus aureus, commonly referred to as staph, is a type of bacteria that has long been recognized as a cause of disease in humans. It is commonly found on the skin and hair, as well as in the nose and throat of people and animals. According to the Centers for Disease Control and Prevention, about 30% of people carry Staphylococcus aureus in their noses. Although most of the time it does not cause harm, it can sometimes cause infections. These range from minor skin infections to more serious infections that can even be fatal in some circumstances. This can be especially true in healthcare settings where patients may have a weakened immune system or have undergone medical procedures that make them more susceptible to infections. These infections may include bacteremia or sepsis, when bacteria spread to the bloodstream, pneumonia, which predominantly affects people with underlying lung disease, endocarditis, which can lead to heart failure or stroke, and bone infections, which can be caused by staph bacteria traveling in the bloodstream or put there by direct contact following trauma. Staph bacteria can also become resistant to certain antibiotics. These drug-resistant staph infections include MRSA, VISA, and VRSA. Anyone can develop a staph infection, although certain groups of people are at greater risk. These include people with chronic conditions such as diabetes, cancer, vascular disease, eczema, and lung disease. Staph is frequently spread to others by contaminated hands and person-to-person contact. Staph can also cause food poisoning if a food handler contaminates food and then the food is not properly refrigerated. Other sources of food contamination may include the equipment and surfaces on which food is prepared, as staph can multiply quickly at room temperature. These are just a few things.
What kind of virulence factor does the pathogen possess? Virulence factors include the cell use of biofilm for protection, the protein phantom, valentin, leukocytin, a toxin that forms pores around the white blood cell membrane which causes them to brush. It has a capsule. This inhibited pathology engulfment is had attention to skin. The human cells also has numerous different types of the toxins. How is Staphylococcus aureus acquired? Skin to skin contact, direct touching contaminate object. In the case of community acquired, MRSA is obtained by living in close quarters. More skin to skin contact, teen athletes, military recluse, prison inmates. How is disease treatment? Some skin infections do not require treatment. Some require incisions and drainage. If actually the primary and most common treatment, and antibiotic treatment. If the strain of Staphylococcus aureus is MRSA, it could possibly the antibiotic resistant. Therefore, making sure what antibiotics we kill and the bacteria is extremely important. Thanks.